Andreas Münzer died on March 14, 1996, at just 31 years old after experiencing multi-organ failure created by prolonged, extreme conditioning practices. His contest preparation involved maintaining body fat levels estimated under 4%, while using high-dose diuretics to remove nearly all subcutaneous water. Diuretics increase urine output and reduce total fluid volume, which thickens the blood. Thicker blood requires greater pumping force, raising cardiovascular strain. Münzer's drug protocol also included stimulants and anabolic agents that accelerated metabolism and further reduced electrolyte stability. Electrolytes regulate heart rhythm and nerve signaling. Severe depletion causes arrhythmias and impaired kidney filtration. When Münzer was hospitalized in 1996, doctors documented massive internal bleeding originating from gastrointestinal damage linked to long-term drug stress. His liver showed substantial deterioration, and his kidneys were unable to regulate fluids or remove toxins. Laboratory scans revealed almost complete absence of body fat and significant water depletion. Organ systems began shutting down sequentially because the body could no longer maintain internal regulation. Kidney failure prevented electrolyte balance, while liver failure stopped toxin clearance. The combined effect produced fatal multi-organ collapse. Münzer's death became one of the most medically detailed cases demonstrating the limits of extreme pre-contest dehydration strategies. Mohamed Benaziza died on October 4, 1992, at 33 years old, one day after competing in the Holland Grand Prix. His death followed rapid dehydration procedures used to achieve maximum muscle definition on stage. Reports from the competition stated he appeared extremely dry, indicating substantial use of diuretics. These chemicals force accelerated water loss and reduce electrolyte concentration in the blood. Electrolytes such as potassium regulate cardiac electrical activity. Depletion increases the likelihood of fatal arrhythmias. Immediately after the 1992 event, Benaziza complained of severe cramping, exhaustion, and difficulty breathing. Witnesses said he refused medical treatment despite symptoms consistent with electrolyte collapse. Continued dehydration after the show increased blood viscosity and elevated heart workload. This combination can cause sudden cardiac instability because the heart cannot pump thickened blood efficiently. Autopsy evaluations confirmed that his respiratory system was compromised by fluid imbalance and that his heart was under extreme stress. He died in his hotel room the morning after the competition. Benaziza's case became one of the earliest documented fatalities directly connected to competitive-level dehydration practices. His death in 1992 prompted governing bodies to revisit drug testing protocols, hydration monitoring, and athlete weigh-in standards because it demonstrated how fast electrolyte imbalance can progress to fatal cardiac arrest. Dallas McCarver died on August 22, 2017, at only 26 years old after suffering sudden cardiovascular failure combined with choking during a collapse at home. His autopsy documented severe cardiomegaly, with his heart weighing over 550 grams, significantly above the normal adult male average of 300 to 350 grams. Enlarged heart muscle increases oxygen requirements and disrupts electrical conduction pathways. McCarver also showed extensive atherosclerosis, with major arteries narrowed by plaque despite his young age. During the incident, food obstruction blocked McCarver's airway, preventing oxygen intake. Without oxygen supply, heart rhythm destabilizes within minutes. Toxicology reports from 2017 showed multiple performance-enhancing substances that increase red blood cell count, elevate blood pressure, and accelerate cardiac growth. These compounds raise cardiovascular workload even in resting conditions. At over 300 pounds, McCarver's body mass required high oxygen usage, increasing the risk of system overload when airflow was blocked. His autopsy further noted pulmonary congestion and vascular strain, indicating that his cardiovascular system was already compromised before the obstruction event occurred. The combination of cardiomegaly, arterial narrowing, high body mass, and sudden hypoxia produced a rapid cardiac collapse. McCarver's death highlighted how structural heart changes in large competitive bodybuilders escalate the risk of fatal events even outside contest preparation. George Peterson died on October 6, 2021, at 37 years old, 3 days before competing at the 2021 Mr. Olympia. His autopsy documented cardiac arrhythmia associated with significantly elevated heart size and fluid imbalance. Peterson was found unresponsive in his hotel room, and toxicology testing identified high concentrations of diuretics and anabolic compounds consistent with late-stage contest preparation. Diuretics increase urination to reduce water retention, but excessive use lowers potassium and sodium levels. These electrolytes are required for electrical signaling that coordinates heartbeat rhythm. When depleted, the heart develops unstable firing patterns that can rapidly transition into lethal arrhythmias. Peterson's cardiovascular system showed stress markers including left ventricular hypertrophy, meaning the heart wall had thickened beyond normal limits. This condition raises oxygen requirements while reducing efficiency in pumping blood. Additionally, laboratory findings indicated abnormal fluid shifts in the body, suggesting dehydration was present at the time of death. His body weight in peak condition typically ranged from 210 to 220 pounds, requiring substantial circulatory output. Contest protocols can reduce fluid volume to dangerously low levels, which thickens the blood and increases workload on the heart. The interaction of hypertrophy, electrolyte imbalance, and dehydration created conditions that destabilized cardiac signaling and caused sudden fatal arrhythmia. Cedric McMillan died on April 12, 2022, at 44 years old following cardiac complications linked to long-term cardiovascular stress and respiratory dysfunction. Prior to his death, McMillan had experienced multiple health issues including pneumonia, chronic breathing problems, and heart irregularities documented between 2021 and 2022. Respiratory impairment restricts oxygen intake, which forces the heart to work harder to supply oxygen to tissues. Over time, this contributes to structural changes such as ventricular hypertrophy. Elevated heart mass increases the risk of arrhythmias and reduces the efficiency of cardiac output. McMillan's competitive weight often exceeded 270 pounds. Placing consistent metabolic demand on the cardiovascular system. Autopsy findings and medical reports referenced cardiac scarring and impaired arterial elasticity. Reduced arterial elasticity limits the artery's ability to expand and contract, increasing blood pressure and heart strain. McMillan also used performance-enhancing substances throughout his career, which can accelerate red blood cell production, elevate blood pressure, and enlarge cardiac muscle. These factors compound pre-existing vulnerabilities created by respiratory illness. During his final months, he reported difficulty maintaining stable breathing patterns, which further stressed the heart by limiting oxygen availability. When oxygen levels fall, the heart increases contraction force to compensate, raising the risk of rhythm disturbances. McMillan's death involved the convergence of infection-driven respiratory impairment and chronic cardiovascular remodeling, resulting in fatal cardiac dysfunction. Sean Roden died on November 6, 2021, at 46 years old from a reported heart attack linked to advanced heart disease. Medical evaluations indicated that Roden had significant atherosclerosis, meaning major arteries supplying the heart were narrowed by plaque buildup. When arterial passages shrink, blood flow becomes restricted, reducing oxygen supply to the heart muscle. Reduced oxygen availability increases the likelihood of myocardial infarction, commonly known as a heart attack. Heart attacks occur when blockage cuts off oxygen, causing tissue damage and interrupting electrical conduction. Roden's competitive physique typically exceeded 240 pounds on stage, requiring substantial cardiovascular output. Prolonged exposure to performance-enhancing substances can increase red blood cell volume, thicken the blood, and elevate blood pressure. These conditions place long-term strain on arterial walls, accelerating plaque formation. Lifestyle stress, contest dieting, and dehydration cycles further affect vascular integrity by altering blood viscosity and increasing inflammation markers. In 2021, Roden's health status was already under scrutiny, and reports from individuals close to him indicated he was addressing cardiovascular symptoms prior to his death. Age-related risk combined with long-term competitive stress increased the likelihood of arterial blockage. When oxygen delivery to heart tissue drops below functional threshold, electrical instability develops, leading to sudden cardiac arrest. Roden's condition represented advanced heart disease that progressed to fatal myocardial failure. Greg Kovach died on November 22, 2013, at 44 years old from heart failure associated with significant cardiac enlargement and long-term cardiovascular strain. During his competitive years, Kovach was known for reaching body weights of 400 to 420 pounds in the off-season and over 330 pounds on stage, levels that require extreme cardiac output to supply oxygen to an enlarged musculature. His heart adapted to this workload by increasing muscle mass, a condition known as hypertrophy. Hypertrophic cardiac tissue requires more oxygen while pumping less efficiently, increasing the likelihood of heart failure. Medical reports indicated that Kovach developed cardiomyopathy, a disease in which the heart muscle becomes weakened or structurally abnormal. Cardiomyopathy affects electrical conduction pathways, increasing the risk of arrhythmias. Kovach also experienced elevated blood pressure due to the combination of high body mass and performance-enhancing substances, which thicken the blood and increase vascular resistance. Over time, high vascular resistance forces the heart to exert greater pressure with each contraction, producing cumulative damage. His autopsy findings showed significantly enlarged heart size and impaired ventricular function. Impaired ventricles cannot move enough blood through the circulatory system, leading to fluid buildup and reduced oxygen transport. This condition progresses to heart failure, when the heart can no longer meet the body's metabolic demands. Kovach's size, cardiovascular remodeling, and chronic physiological stress contributed directly to his 2013 fatal event. Luke Sandoe died on May 7, 2020 at 31 years old, with medical reports indicating cardiovascular dysfunction linked to underlying heart abnormalities and competition-related physiological stress. Prior to his death, Sandoe withdrew from the 2019 Mr. Olympia due to health complications, signaling the presence of ongoing medical concerns. Autopsy findings referenced cardiac hypertrophy, meaning the heart had thickened beyond normal size, which increases oxygen demand while reducing pump efficiency. Sandoe's typical competitive weight ranged from 250 to 260 pounds, requiring elevated cardiovascular performance to supply oxygen to large muscle mass. Long-term exposure to anabolic substances increases red blood cell concentration, blood thickness, and blood pressure. These conditions heighten the risk of arrhythmias by altering the heart's electrical conduction environment. Additionally, stress associated with contest preparation, specifically low-calorie dieting and dehydration, can reduce electrolyte levels. Electrolyte depletion interferes with the signaling required for coordinated heart contractions. Medical professionals close to the case noted that Sandoe had a history of emotional and physical stress in the months before 2020, which compounds cardiovascular load by increasing cortisol and blood pressure. His death occurred suddenly at home, consistent with acute arrhythmic events triggered by the interaction of hypertrophy, electrolyte imbalance, and long-term vascular strain. Sandoe's case demonstrates how structural heart changes, combined with competitive pressures, can lead to fatal cardiac instability. Art Atwood died on September 11, 2011, at 37 years old, after experiencing a sudden cardiac event while swimming at his apartment complex. Emergency responders documented that he went into cardiac arrest before they arrived. Autopsy results later confirmed significant cardiovascular disease, including arterial plaque buildup and enlarged heart muscle. Arterial plaque reduces blood flow by narrowing passageways that deliver oxygen to the heart. When the heart becomes oxygen-deprived, electrical conduction becomes unstable, increasing the risk of arrhythmias and sudden arrest. Atwood's competitive body weight often exceeded 250 pounds, with off-season weight rising to around 300 pounds, which substantially increases circulatory demand. Enlarged musculature requires more oxygen, forcing the heart to increase contraction strength. Over time, this creates hypertrophy, thickening of the heart muscle that eventually reduces pumping efficiency. Elevated blood pressure, a common side effect of both body mass and performance-enhancing substances, accelerates damage to arterial walls and promotes plaque formation. During the 2011 incident, physical activity in the pool would have increased his heart rate and oxygen requirement. When an artery supplying the heart cannot deliver enough oxygen during heightened activity, arrhythmia or myocardial infarction becomes more likely. Atwood's death reflected the progression of long-term cardiovascular remodeling, reduced arterial capacity, and acute demand during physical exertion. Nasser El Sonbaty died on March 20, 2013, at 47 years old from kidney failure associated with long-term organ stress, high protein turnover, and extended use of performance-enhancing substances. During his competitive career, Nasser frequently weighed 280 pounds on stage and more than 300 pounds in the off-season, which increased metabolic demands placed on the kidneys. Kidneys filter waste products generated by protein metabolism. When protein intake and muscle mass rise significantly, filtration workload rises as well. Over time, this contributes to chronic kidney stress. Nasser reportedly contracted a severe infection while traveling in 2012, which weakened his immune system. Compromised immunity can accelerate organ deterioration because inflammatory responses increase kidney workload. Medical reports referenced pre-existing kidney damage before the infection, indicating a multi-year decline rather than a single event. Performance-enhancing compounds can elevate blood pressure, which is a major risk factor for kidney disease. High blood pressure damages the microscopic vessels in the kidneys responsible for filtration. His death in 2013 occurred after a prolonged period of organ fatigue, during which the kidneys could no longer regulate electrolytes or remove metabolic waste. When kidney filtration drops below functional threshold, toxins accumulate in the bloodstream, and disrupt cardiac and neurological functions. Nasser's case demonstrates how chronic organ stress combined with acute infection can accelerate kidney failure. Mike Matarazzo died on August 16, 2014, at 48 years old, following complications from heart disease and multiple cardiac surgeries. Matarazzo was diagnosed with severe coronary artery disease as early as 2004, when he required quadruple bypass surgery at only 38 years old. Coronary artery disease occurs when plaque accumulates inside arteries supplying oxygen to the heart. As plaque thickens, arterial openings narrow, reducing blood flow and increasing the risk of heart attack. Matarazzo's competitive weight often exceeded 250 pounds, and he consumed high caloric and protein intake to sustain muscle mass. Diets rich in saturated fats can elevate cholesterol levels, which accelerates plaque formation. Combined with long-term use of performance-enhancing substances that raise blood pressure and red blood cell density, these conditions produced chronic cardiovascular strain. After retiring from bodybuilding, Matarazzo continued to experience chest pain and decreased cardiac function, indicating progressive arterial blockage. By 2014, his heart function had declined significantly. Hospitalization records noted that his heart could no longer pump blood effectively due to widespread arterial obstruction and weakened cardiac muscle. When cardiac output drops, oxygen supply to organs falls below required levels, leading to system-wide failure. Matarazzo's death resulted from advanced coronary artery disease that overwhelmed cardiac function despite surgical intervention. Daniele Seccarecci died on September 5, 2013, at 33 years old, from a reported heart attack linked to extreme cardiovascular stress and long-term performance-enhancing substance use. Seccarecci was known for achieving body weights exceeding 300 pounds, making him one of the heaviest competitive bodybuilders in Europe. Maintaining such mass requires substantial circulatory output and increases heart workload. Enlargement of the heart muscle, or hypertrophy, occurs when the heart adapts to pumping against sustained high resistance. Performance-enhancing substances elevate blood pressure and thicken the blood by increasing red blood cell concentration. Thickened blood requires higher pumping force, generating additional stress on the heart and vessels. Autopsy details referenced significant cardiac enlargement and arterial abnormalities consistent with prolonged hypertension. When arteries stiffen or narrow, the heart must contract harder to move blood, heightening the risk of myocardial infarction. Seccarecci's death occurred during a period of legal and competitive pressure, which may have added psychological stress. Psychological stress increases cortisol and adrenaline levels, both of which raise heart rate and blood pressure. When combined with structural heart changes, this creates conditions favorable for sudden cardiac arrest. His 2013 death illustrates the cumulative impact of high body mass, vascular strain, and long-term substance use on cardiovascular stability. Baytullah Abaspour died on August 27, 2015, at 36 years old after complications from vasculitis, a condition in which blood vessels become inflamed and progressively narrow. Vasculitis reduces blood flow to organs and tissues, increasing the risk of failure in systems that rely on steady oxygen delivery. Abaspour's condition was documented in 2014, when he was hospitalized multiple times for kidney-related issues. Kidneys depend on consistent blood flow to filter toxins. When vascular inflammation restricts circulation, kidney filtration capacity declines, leading to toxin accumulation. Abaspour typically competed at 210–220 pounds with extremely low body fat, requiring high metabolic turnover. Elevated metabolic waste production places additional strain on kidneys already impaired by vasculitis. Medical reports indicated that inflammation spread to multiple organ systems, creating widespread vascular instability. Performance-enhancing substances can elevate blood pressure, which worsens vessel damage in individuals with pre-existing vascular disease. Increased blood pressure raises shear stress on vessel walls, accelerating deterioration. By 2015, Abaspour's kidneys could no longer regulate fluid levels or electrolytes. Electrolyte imbalance destabilizes heart rhythm and disrupts nerve signaling. His hospitalization in the final months showed progressive multi-organ compromise caused by blocked or inflamed vessels unable to maintain normal circulation. Abaspour's death resulted from systemic vascular failure, amplified by metabolic demands of high-level bodybuilding. Rich Piana died on August 25, 2017, at 46 years old, after collapsing at home and spending more than 2 weeks in a medically induced coma. Medical reports documented severe cardiac enlargement, with his heart weighing over 700 grams, more than double the normal range of 300 to 350 grams. Enlarged cardiac muscle increases oxygen requirements and disrupts electrical pathways needed for coordinated contractions. Autopsy findings also indicated fatty infiltration of the heart and significant vascular strain. Piana admitted publicly to long-term anabolic substance use beginning in the 1980s, which can elevate blood pressure, thicken the blood, and accelerate heart growth. Thickened blood requires greater pumping force, increasing workload on the heart. Piana also weighed 290 pounds throughout much of his career, contributing to chronically high oxygen demand. Elevated metabolic requirements forced the heart to enlarge over time to meet circulation needs. During the 2017 incident, Piana collapsed while receiving a haircut, and responders reported agonal breathing, an indicator of severe cardiac distress. Toxicology reports noted multiple substances influencing cardiovascular strain. His hospitalization revealed widespread organ stress, including compromised respiration and unstable cardiac rhythm. Piana's death reflected long-term cardiovascular remodeling and cumulative strain that eventually exceeded the heart's functional limit. Aziz Shavershian, known globally as Zyzz, died on August 5, 2011, at only 22 years old from cardiac arrest triggered by an undiagnosed congenital heart condition. Medical examination confirmed a congenital heart defect involving a structurally weakened coronary artery, reducing its ability to supply consistent blood flow. When coronary arteries have reduced stability or diameter, oxygen delivery can become impaired during physical stress. Shavershian was traveling in Thailand at the time and collapsed in a sauna, where high heat increased heart rate and oxygen demand. Heat exposure raises core temperature and forces the cardiovascular system to pump faster to cool the body. In individuals with underlying structural defects, this can trigger arrhythmias. Zyzz reportedly weighed around 200 pounds with low body fat, increasing metabolic and circulatory requirements. Although toxicology results in 2011 identified stimulant traces, the primary cause of death remained the undiagnosed congenital defect. Structural heart abnormalities disrupt electrical conduction patterns and can cause sudden cardiac arrest without prior symptoms. When oxygen demand rises beyond what the compromised artery can supply, electrical instability occurs, leading to lethal rhythm failure. Zyzz's death demonstrated how congenital conditions can remain hidden until external stressors, such as heat exposure or dehydration, exceed cardiovascular capacity. Andreas Frey died on October 20, 2022, at 43 years old, reportedly from a sudden cardiac event during sleep. Frey was known for competing at weights between 260 and 290 pounds, requiring increased cardiac output to sustain his physique. Chronic cardiovascular demand contributes to left ventricular hypertrophy, a condition in which the heart wall thickens. Thickened heart tissue reduces chamber volume, limiting the amount of blood pumped with each contraction. This condition increases the risk of arrhythmia and sudden cardiac arrest. Frey had retired from competition years before 2022, but maintained substantial muscle mass and training intensity. Performance-enhancing substances used during his earlier career can produce long-term cardiovascular effects, including arterial stiffness and elevated blood pressure. Arterial stiffness reduces the vessel's ability to expand and contract, increasing resistance against which the heart must pump. Elevated resistance accelerates heart fatigue. Reports following Frey's death indicated no signs of external trauma, consistent with sudden arrhythmic events occurring during rest. During sleep, heart rate slows, but individuals with hypertrophy remain at elevated risk because electrical conduction remains unstable. When conduction misfires, the heart can enter a non-pumping rhythm, such as ventricular fibrillation. Without immediate intervention, circulation stops abruptly. Frey's death reflects long-term cardiac remodeling consistent with decades of increased vascular and metabolic demands.